Hey guys, it's Drew.
And it's Greg. Hey guys, we just wanted to give you a quick update on what we've been up to this week. We got to start really getting on campus and start seeing hospitals and lecturing. So I'm going to start off with our hospital experience. So we went to a public sector hospital this week on Tuesday called Dora Nginza, and it was a very interesting experience. We started off Tuesday in the obstetrics ward, and what we got to see were a couple of patients. One was an HIV infected patient who was experiencing preeclampsia, so that was pretty interesting to see their drug therapy for that, as well as a pregnant patient who had experienced a insect bite. So nothing too big there, but it was interesting to see what their approach was with antibiotics, even though there might not be an infection. So that was our first day there, and I think Drew's going to take the next day.
All right, so on the second day we went to the psych ward, and it was really interesting because when we walked up to it, the whole thing was on lockdown. Apparently someone had stolen something, so they were trying to figure out what was going on. So we didn't get to go into the actual ward. They did hand us the files, and we were able to look through them. One patient was a 16-year-old female who had substance abuse issues. Another patient was, I think he was like a 25-year-old male, suffering from a bipolar episode that his parents had brought him in after trying to attack them and stuff. It was kind of an interesting file to read. So then on the third day we headed up to the pediatrics ward.
And in the pediatrics ward we got to see some pretty interesting things. It was a pretty relaxed day. There were some dietitian students there as well, so it was pretty crowded, so we had to split up. Didn't get to see as much as we had hoped, but some of the things we did get to see. There was a child who was diagnosed with Guillain-Barré syndrome, which is a syndrome that's pretty rare here in South Africa and I think nationally. But it's where the immune system attacks the body itself, and so it paralyzes the individual. You recover from it typically over time, and it's kind of an automatic thing. But it's interesting to see that disease state, as well as some children who had been exposed to HIV or retroviral disease, they call it here in South Africa. So. And what their treatment is for that. So that was pretty fun, a pretty relaxed day, but still fun to see some interesting cases there.
So another thing we did this week is we started our lectures. Part of our rotation is we're working with the NMMU, the Nelson Mandela Metropolitan University, and we're teaching some of the pharmacy technician students there. So on Wednesday we actually covered the topic of sunscreen and sun tanning products. So we were able to talk about the levels of sunburn and what products to recommend to patients as they came in for recommendations. Then this morning actually, we talked about burns and burn care. So basically we're teaching them what we would equate to at Stillcop our OTC sections. So it's been really interesting kind of seeing the opposite side of teaching these kind of courses compared to being sitting in the class. Seeing what works, what doesn't work, how to get the students involved and keep them interested in the lecture. So later today we're actually going to Daniel Cheetah Park, so we're going to head out there pretty soon. Hopefully get to pet some cheetahs, and apparently we get to walk them as well, so it'll be kind of cool. And then tomorrow we're headed up to Scotia Game Reserve to do a safari in the morning, and then later in the afternoon we're headed up to Otto Elephant Park, which is a really big elephant sanctuary here in South Africa. Not too far away from us actually.
Yeah, so far some of the things we got to do, which we didn't mention in our vlog last time, there's a place here called Bay World, and what it is, it's a pretty interesting museum of all the history of South Africa and the settlement of the area, as well as an ocearium. So they've got seals, big turtles, kind of equated to the St. Louis Zoo with the water wildlife. But they also have the snake park where you can view different snakes in the area, and we got to actually hold one, and I'll post a picture below. But it was pretty cool, a pretty fun experience. Apparently there used to be dolphins there, and it used to be a lot more fun, but we still had a good time. And then we also explored a place called Happy Valley, which is pretty much just a beautiful scenic walkway where you would, it has different pretty much displays of Disney movies and different Disney characters throughout. So it's just a walking path. It's a nice break from the everyday hustle and bustle. So far some pretty fun stuff.
So we've been having a good time here. We're going to head out and head up to that Cheetah Park. Remember to follow us with the like button on the bottom or follow button on the bottom. Thank you for listening to our South African pharmacy experience. Talk to you guys soon.
See ya.